Bispecific antibodies have quickly entered the role of options for our patients, particularly with three or four more prior lines of therapy. And those are agents with kind of very specific and unique toxicity that, us in academic centers who have been working with bispecifics and CAR-T for a number of years, that is not as concerning or novel, but for many physicians in the community who are busy treating myeloma and other cancers, the first opportunity they're having to work with bispecific antibodies. So the things that are unique is really the step-up phase, which is the first week of therapy. That's when the patients can have, cytokine release syndrome that requires prompt identification and timely intervention. All the bispecifics that are available have a step-up phase, which really mitigate the risk of severe CRS during the clinical development. So that is made a lot easier for the physician in the community. And they just have to identify and have the ways to address that, usually with steroid or tocilizumab at any time during those first week or so. Once the patient gets past the first target dose and goes to a weekly or biweekly treatment, the risk of CRS is essentially zero. So the concerns at that point are cytopenia, which are very minimal and manageable, and the greatest risk is really with infection. And then there are several recommendations, or COMIT Consortium has itself a publication on mitigating infections for those patients, and I think our experience has been when using those mitigating strategies, the infections are far, far less than we saw in the early trials. On the case of Talquetamab, there's some unique aspect where the infection risk seems to not be as high, so it's less of a concern. But then you have some what's called on-target off-tumor effects, which has to do mostly with dysgeusia, skin rash, skin peeling, and nail dystrophy. And there are several suggestions, several educational materials of things you can do, creams, lotions that patients can apply to ease those symptoms, as well as mouth rinses, tips of how to eat and when to eat and what to eat to help mitigate those symptoms. But it's important to keep in mind those symptoms tend to fade away over time. So for patients that oftentimes don't have a lot of other options, it's important to give the positive reinforcement that this is normal, is expected, do this, do that, hang in there, it's going to get better, and most important, we have your myeloma under control.